So back out here, we are live with the Hawksworth Mobile Blood Donation Unit. It is not in use right now, but it allows us to be at least 6 feet from our guests here. And right behind me, you can see that Tony Remington is here from Gravity Diagnostics. We're going to talk with him in just a moment, but there is a new testing site this week, and we want to let you know a little bit more about the backstory on it. The newest option opened today in Erlanger at the Atlantic Corporate Center on Olympic Boulevard. It's a drive-through test site expected to be open for at least the next 2 weeks.
We do one about every 3 minutes, essentially. They'll come through. Boone County Emergency Management helps with the traffic flow, so we don't have any issues there. They'll go through a tent. We actually have 2 lanes of testing available, so they go through a tent. And we have clinical staff who do the swabbing, so unlike some of the other locations across the state and in the market, we actually have clinical associates who do the test for you, and then we give you a little slip of paper that tells you how you'll get your results, and you go on your way.
The tests are then analyzed at Gravity Diagnostics in Covington, and you get your results in 48 to 72 hours.
They'll be available inside the patient portal for patients who have access to that, who are our patients. They can sign up to get access to it, or a member of our pharmacy team will do outreach and call them with results.
So something that's different, you're testing people with and without symptoms here?
Yes, you don't have to have symptoms to be tested. We're testing asymptomatic and symptomatic patients, so you just have to have an appointment, so patients can call our call center and get an appointment, and that will allow them to get scheduled and come out for the test.
All right, so joining us now, the team we mentioned in that story analyzing these results, Gravity Diagnostics. Tony Remington is their CEO there. Good morning to you.
Good morning.
So I appreciate you taking a break, and I joke like you're in running shoes because that's been your life now for a while. The reason we wanted to talk to you is that we were there, I think, on the first day when you analyzed 6 tests from COVID-19. You applied weeks before, saw the need coming. Tell me what you're doing now.
Yeah, so I actually, we probably got about 7,000 samples today. I don't know exactly the number, but we've basically, we kept in touch with you along the way, and, I keep saying we blew out a wall, we doubled our capacity, we ordered instrumentation to get up to, 10,000 samples a day, hired about 35 people. We're hiring another 20 right now, mostly on the data entry side. We're working a full shift on Saturday, so 6:30 a.m. to 8 at night on Saturday, and then Sunday we're officially not open because the shippers can't get us samples on Sunday, but the last 2 Sundays we've had about 30 people in the lab, so we're basically doing samples 7 days a week.
All right, well, I'm sorry that you've had this growth, and yet we're grateful that you're there.
Thank you.
This is the place that gets sent all your tests now. We have some video for you to show you of where they are. They are in Covington, so a local company. We're always grateful when business is local, but you've really put a national footprint out now.
Yeah, so we, I always say to everyone, our focus is the state of Kentucky. We signed an agreement with them to make sure we're available for all the hospitals in Kentucky. We have, I think, 99 customers now in Kentucky that we're working with on the state project, but we actually have capacity to also partner with Kroger Health. So we start out doing all the drive-thrus in Kentucky with Kroger to help the state of Kentucky. That went into Ohio, Tennessee, Indiana, Michigan, and last week we agreed to go national with them. So this week we're in the state of Washington, Arizona, Texas. I think we're going to Alaska next week. So it's amazing what overnight shipping can do. So yeah,
and lucky us to have you here. So I want to ask you some of the things other people have been asking me.
Sure.
The first is, are we any closer to an at-home test where I might be able to take it and send it to you?
Yes. There's been some good developments. I always say competition is good. The more testing we can get out there, the better. So I know LabCorp got approval about a week or 2 ago to do some at-home testing. We've been working closely with the FDA on a daily basis. We feel pretty good. We'll have an announcement very shortly, but we don't have it yet.
And you're going to make that here, that announcement?
Yeah, exactly. You'll be the first to know.
Tony and I have a thing about that. Like, don't tell me second.
Yeah, no, I actually, you've been there since the day, when this wasn't, Gravity wasn't on the national news
But
stories.
I saw the potential because you have the passion for what you do, which is why we're here today, and hopefully that's why you're watching. All right, so last question. As we open the country, how do you feel testing will play the biggest role? Why is it important? What do you want us to know?
Yeah, so I've actually talked to a lot of universities. I've talked to some of the professional sports teams, businesses. I think there's a lot of moving parts here, right? So it's always, I try to wear gloves anywhere I go. It's washing your hands, it's distancing like we're doing, wearing a mask, following the state and federal guidelines. I mean, that's all really important. And then there's 2 types of testing. There's what we do. Are you negative or positive for, the COVID? 19, and then there's also the antibody testing, and I think all this testing has a role. It's just really important that people understand what they're getting and what they're not getting. So ideally you would test everyone for the COVID-19 virus, right, as a baseline, but you might not have the funds to do that. You might not have access to the turnaround time you need. You might not have access to the test. So we think what we're doing has a huge role in getting everyone back to work, but we also realize different entities have different kind of struggles with that. So I think all the other things, the mask, the distancing, the washing your hands are really important. And then ideally you would get a negative positive COVID-19 test, and then you'd also get an antibody test, and that would tell you whether you have it now, and then it would also tell you if you ever had it before. And I think that's the goal long term, is to try to get that out while we're waiting for a vaccine.
Well, so far you have been speaking these truths and they've been happening. So we welcome you to come back, and we want to remind you that there is free testing in our area no matter where you work or where you live. And right now getting, as he said, a test to find out if you have it. And if you want antibody tests, we have more on that coming up in just a little while as well. Tony Remington, CEO of Gravity Diagnostics, thanks for putting on the running shoes and running over here. And we'll be right back.
Thank you.